The chest is really hurting. I hope it's not a heart attack. I have to present my palliative care presentation on Friday. I just learned all about how on TV 66% of people survive the discharge after getting CPR, but in real life it's actually only 11%, and only 9% of people get back good functional status. I better call 911.
What happened here?
Yeah, this guy was just running past my house and he collapsed. So I called 911. He didn't have a pulse, so I just started doing chest compressions right away.
Thank you, sir. You might have just saved his life. Did you know that starting chest compressions from a bystander can raise his chance from being discharged from the hospital up to 40%? We'll take it from here.
His heart started back up in the ambulance, but he needs more life support now. As I lay there, all I could think about was how I wished I filled out my healthcare power of attorney, like I was told to on my palliative care rotation.
His heart stopped again. Start chest compressions.
Hi, Tim. So we've run some tests on your heart, and it seems like you'll make a full recovery. Consider yourself very lucky. However, we did find something abnormal on your x-rays. We took them because of your very serious fall. And I'll be honest with you, it's not good news. How much would you like to know about it? Well, because I just did my palliative care rotation, I've already thought about this, and I'd like to know everything you know. So, here's the news. We found an osteosarcoma in your right femur. Did you understand everything I said? No, I'm sorry. After you said osteosarcoma, my mind just went blank. What's the treatment look like for that? Unfortunately, there's a lot we don't know right now. We'll have to do more tests and refer you to oncology, but it will likely involve chemo, radiation, or possibly both. I can't believe this is happening to me. Just yesterday I was seeing patients who have cancer. Now I have it myself. Doc, I'm in a lot of pain in my leg. I'm not sure these treatments are working.
Oh, you're fine.
Doctor, you should know I just did a palliative care rotation as a med student, and I learned that pain is subjective. You should believe me. Dr. Ferris said in one of his videos that 88 to 90% of people are completely reliable. Therefore, there are good odds I'm telling you the truth.
Okay, I believe you.
Great. I've already learned all about how dexamethasone is a great option for bone pain because it inhibits the COX enzyme, and that helps reduce swelling. Can I take that?
Sure. Here's a script.
Thanks! Make sure to take it when the pain starts getting bad, not when it gets to its worst. I already knew that because of my awesome palliative care rotation professors. Bye! Doc, I feel like it's hard to breathe, and it's gotten worse in the last few months. Today, I feel like I can barely breathe at all.
I'm very sorry you're experiencing this. Let me do some tests. So we got the tests back, and there is some concerning news.
Wow, this is so frustrating. I'm doing all the treatments you guys are giving me, and it's not helpful? How can this happen in my 20s? I guess I want to know everything.
Unfortunately, this can happen in some cases. We're doing everything we can to stop this cancer. I can't imagine how difficult this must be for you. We have found metastasis of the osteosarcoma in your lungs and other vital organs.
What? So how long do I have to live?
It's hard to say, but this does not look good. I'll give you my best estimate based off what I've seen in clinical practice, if you'd like.
Yeah, I guess that's fine.
I would say less than 6 months, due to the extent of the metastases.
6 months? Where do I even go from here? I just learned in my palliative care rotation. It means I could qualify for hospice.
Well, I can definitely direct you to some services that will help you realize your goals of care.
I think I'd like that very much. I want to die comfortably, around family, and spend lots of time doing the things I love in the last months of my life, and deciding what I want out of my care. I don't want to suffer more than is necessary. I also learned on my palliative care rotation that hospice will cover the fee of my medications, and doctors and nurses coming to my home.
so proud of how you've handled this. I'm sad to lose you, but I'm so happy for the memories we've made these last few months. It was really hard to even say the words hospice because we associated that with dying soon. But clearly it's helped you get the best out of your last 6 months.
I couldn't agree more. As your mom, it was so nice to see you not in any pain. We've made so many great memories and got to go on one last family vacation.
I'm happy too. If it weren't for my palliative care rotation, I don't know where I'd be. Scary.